Today, we're going to talk about the digital side of modern healthcare. We're going to take a journey from those old, cluttered paper charts to the super high-tech world of nursing informatics. Let's get right into it.
So what if a doctor's messy handwriting could actually put a patient at risk? I know, it sounds kind of dramatic, right? But for decades, this was a real, constant danger. Just try to picture a busy hospital ward. You've got stacks and stacks of paper charts, notes that are almost impossible to read, and all this critical information that could just get lost. Or worse, get misinterpreted. This wasn't just messy, it was a huge patient safety issue. So how do we fix it?
Well, the answer came from a field that's basically a bridge, right? It connects that hands-on patient care we all think of with some really cutting-edge technology. And that field? It's called nursing informatics. And trust me, it has completely changed the game for how nurses work.
Okay, so what exactly is it? This is the official definition from the American Nurses Association, and yeah, I know, it sounds a little academic. But if you boil it all down, the key thing to remember is this. It's all about mixing the science of nursing with the power of data. And why? To make better, faster, and most importantly, safer decisions for patients.
So, what does this actually look like in a nurse's day-to-day? Well, it's pretty much woven into everything they do. I mean, from entering data into an electronic medical record, to scanning a barcode to make absolutely sure they've got the right medication, to even just quickly researching something online. This isn't some far-off, abstract idea. Nope, it's the real, on-the-ground, daily routine of nursing today.
And right at the heart of this whole transformation is one single, crucial tool, and that's the digital patient chart. You'll hear it called the electronic medical record, or just EMR for short. And let me tell you, this one thing, it changed everything.
So these EMR systems, you might have heard of ones like Epic or Meditech. They're like this central command center for all patient info. Every single thing, from an intervention to a medication, it all gets documented there. And here's the really crucial part. It means the doctor, the nurse, the pharmacist, the lab tech, they can all see the exact same up-to-the-minute information. It creates this amazing, seamless network of care. And this really gets to the core benefit, right? Boosting patient safety and efficiency. When you have information that's easy to read, easy to access, and in real time, the risk of medical errors just plummets. And at the same time, the efficiency of care shoots way up. I mean, get this. Some studies show that hospitals using these systems can slash serious medication errors by more than half. That's huge. It's a fundamental upgrade for patient safety.
But informatics is about more than just documenting what's already happened. It's also about putting knowledge right at your fingertips. We're talking about giving nurses instant access to, like, a global library of medical knowledge, right there at the exact moment they need it most.
So let's say you're a nurse and you need to double-check a medication or a procedure. Maybe you're about to give a drug you've never seen before, or you just need a quick refresher on something complicated. Back in the day, that meant you had to go hunt down some heavy, dusty textbook. But today, the answer is literally just a few clicks away. And what they're clicking on are these super powerful online nursing resources. Think of databases like Lippincott or Micromedics. And let's be clear, this is not just a medical version of Google. No way. These are peer-reviewed, evidence-based databases packed with the absolute latest information. They help nurses make those critical clinical decisions with way more confidence. It's basically an incredible digital safety net, It just enhances their practice and ultimately patient safety. Okay, so we've got the digital chart and we've got the digital library. The last big piece of this puzzle is creating a real network of care.
And that means connecting the people, the entire healthcare team, instantly and effectively.
And believe it or not, this is what hospital communication used to look like. And I mean, not that long ago. It was all about tracking people down in the hallway, blasting overhead pages, or just playing endless phone tag. So slow, so inefficient, especially when every single second can count. But today, it's a completely different world. Nurses have these modern communication devices, things like the Vocera that you can just clip on your uniform, or secure mobile phones for instant messaging. Even the call bell systems are smart now, routing a patient's request to the exact right person, immediately. It creates a truly real-time network of care. But of course, this massive shift to digital, it's not all sunshine and roses. It's not without its challenges. Like pretty much any huge technological change, it's kind of a double-edged sword. So let's take a look at the pros and the cons.
Okay, so on the positive side, the impacts we've been talking about are undeniable, right? Increased patient safety, more efficiency, better communication. But on the negative side, there are some real hurdles. I mean, the learning curve can be super steep, especially for veteran nurses who are used to the old paper systems. And what happens when the system goes down? Even for just a few minutes, it can throw an entire unit into total chaos. And yeah, digital records get rid of messy handwriting, but they bring in new risks like a simple data entry error, a typo that could lead to the wrong dose. It's a constant balancing act for sure.
But here's the thing you have to remember. Despite all the challenges, the goal is always the same. Every new system, every single device, every line of code, it's all about one thing: providing safer, more effective care for the patient. Technology is just the tool. The patient is always, always the purpose.
And that really brings us to a final, pretty crucial thought to leave you with. As healthcare technology and AI get even smarter, they're playing a bigger and bigger role in diagnostics and data analysis. It leaves us with a really important question. As healthcare AI evolves, what is it that remains uniquely human about nursing? In a world of pixels and processors, what part is just irreplaceable? It's definitely something to think about. Thanks so much for joining us for this explainer.